Good afternoon, everyone, and welcome to this week's webinar from the Atlanta Regional Commission, entitled How We're Serving the Region's Older Residents During COVID-19. We are coming to you live from all across the region this afternoon with great speakers to tell you about how ARC's Aging and Independent Services and its partners have been working to meet the nutrition needs of older adults, as well as how exactly ARC works with both individuals and aging providers in the 10 counties, as well as what is available in those counties. My name is Kate Sweeney, and I will moderate today's webinar. Next slide, please. Before we get started, I'd like to go over a few housekeeping items so you know how to participate in today's event. For those of you who have joined us on previous webinars, some items have changed. We've taken a screenshot of an example of the attendee interface. You should see something that looks like this in the upper right-hand corner of your own computer desktop. By default, you are listening via your computer's speaker system. If you would prefer to join over the phone, go to the audio pane, select telephone, and the information for how to dial in will be displayed. Today's presentation is interactive. You will have the opportunity to submit text questions to our presenters by typing those questions into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address them during the Q&A session at the end of the webinar. You will also see chat messages from us in that window. Finally, we are doing interactive polling during today's webinar, and we hope you'll participate. Our poll for today will appear on the next slide. Next slide, please. And here it is. Today's poll question is, tell us about your volume in requests for services and information in the last 3 months. So please go ahead and take a moment now to select one of these responses. And we'll give that about 1 minute. All right, if you're going to respond, go ahead and do so. And let's go ahead and close the poll. And here are the results. So it looks like we are 36% of respondents have had more requests than normal, followed by 33% whose calls and requests have remained about the same, and 31% of you have had fewer requests than normal. So about a third, and a third. It's a really great segue to our speakers. Next slide, please. I'll go ahead and introduce our first speaker of the day. It's Becky Kurtz. Becky leads the Area Agency on Aging for the 10-county Metro Atlanta region within the Atlanta Regional Commission, or ARC. As Metro Atlanta's Aging and Disability Resource Connection, ARC connects older adults, persons with disabilities, and their caregivers to resources, services, and supports. Together with partners, ARC enhances the independence of Metro Atlanta's rapidly growing aging population through services, planning, and advocacy. Previously, Ms. Kurtz worked in the federal government as the National Director of the Office of Long-Term Care Ombudsman Programs. In this position, she worked on aging and disability programs and policies at the U.S. Administration for Community Living. That's an entity within the Department of Health and Human Services. For 16 years, she was the long-term care ombudsman for the state of Georgia, working to enhance the health, safety, welfare, and rights of the state's long-term care facility residents. She has also led the Senior Citizens Advocacy Project of the Atlanta Legal Aid Society and worked for the City of New York Law Department. A native of Western North Carolina, she is a graduate of Columbia University School of Law and Emory and Henry College in Emory, Virginia. Becky, thanks for joining us.
Thanks, Kate. And hopefully everyone is seeing my screen.
Not yet, Becky. You have
Great.
to.
Thank you for confirming that. So I'm trying to get this all out here. Okay. So as Kate said, we are at ARC, the Metro Atlanta's Area Agency on Aging. And I want to tell you a little bit about what that means, why that matters, and then what we've been doing in our region together with partners. So glad to have the opportunity to speak with you today.
Hey,
And
Becky, we still can't see your screen.
You cannot see my screen.
Nope.
Got it. Is that better?
Yep, now we're good. Thank you.
Yes, thank you. I thought you were seeing it, so I appreciate you interrupting me, Jared. So so what I was saying is I'm glad to be with you all today. Hope you're staying well. And we have been doing a lot at ARC, along with a really amazing network of partners in serving the region's older residents during COVID-19, and really appreciate the opportunity to help you all understand a little bit about what's been going on in our region. So as Kate said, we are the Metro Atlanta's Area Agency on Aging for the 10-county region. And what does that mean? Well, it means that we're federally and also state designated to be the area agency on aging to receive federal and state funds in grants, which then are used for the aging services needs in our area. Our responsibilities include planning for the region's rapidly growing aging population. Our region has about 800,000 individuals who are over age 60 currently, but if you look to the future, we're by far looking at that 60 plus population being the most rapidly growing portion of our population. So watch for that number to grow rapidly in coming years. We're also a provider of services, and especially what we do directly, ARC staff directly connect individuals to services. And we'll talk a little bit about that connecting role that we have for individuals. And then partnering. We partner with leaders and with direct service providers. And when I say we partner with direct service providers, much of that is through the grants that we provide to county governments and to nonprofits in our region using the federal and state grant funds that we receive at ARC. And last, but certainly not least, the last thing that we do as an area agency on aging, or AAA for short, is policy advocacy to improve the lives of the older persons in our region. Everything that we do that is consumer facing, whether it's services or information that we're providing, we call Empowerline. And so we're designing an age and ability friendly region for all of our residents through our Empowerline services. And we'll be telling you more about that. Since mid-March, our Empowerline counselors have linked older persons and individuals with disabilities and their care partners to community resources. And we do that thousands of times each month. Thousands more have obtained information through our website, empowerline.org, as well as our social media channels. And we've been updating all of those information resources to focus on the special needs during this COVID-19 pandemic and the special needs of older adults. I want to say a few things about normal times and how service happens typically, in case some of you are not aware. Our staff directly provide a number of services, and this is not a comprehensive list. This is just sort of an example list. We provide information counseling, and Cara will later tell you a little bit more about that. We provide intake and screening. We're the entry point for Medicaid-funded home and community-based services. We manage a wonderful group of volunteers through our RSVP program. We provide wellness education where we utilize evidence-based programs to help individuals manage their chronic conditions or prevent falls or a variety of other wellness programs that we have. And we have one-on-one consultation with care partners who need some extra support to empower them to be effective care partners. And then we also provide access to assistive technology to help maximize individuals' independence in their homes and communities. And one other that I'll mention, even though I didn't put it on the slide, is that we also help transition individuals from nursing homes into community residential settings, whether it's their own home or apartment or a family's home. So those are just a few of examples that we provide directly at ARC. A huge amount of other direct service happens during normal times through our federal and state grants to fund our network of partners. And the services that they provide are home delivered meals. We'll talk a little bit more about that soon. Nutrition and activities at senior centers. And you can imagine that world has changed for us, as have transportation services. In-home services, including personal care, that's helping someone get a bath or get dressed. Homemaker services to help them keep homes clean. Case management to help them plan for the service needs that they have. Respite, giving a break to care partners. And then legal services as well. And so when I say partners, I'm talking about our 10-county region, the county agencies and nonprofits who help provide these direct services. So what's been changing? Well, the kinds of information we've been giving has been changing. So our information counselors have changed what the questions that they're answering and the information they're giving. We've been changing empowerline.org and our social media platforms to make sure people are getting relevant information at this time. And we've been updating our Empowerline Pro or ePro, which is a resource database for professionals that is used statewide, but that ARC hosts, and we continuously update with updated information, including relevant to COVID-19. We also have been serving as a clearinghouse to coordinate resources with local needs. So we've been periodically taking surveys of our partners to say, what are the unmet needs in your community? And then partnering with folks who have donations to give, whether those are in kind, like hand sanitizers and masks, or grocery boxes, or whether those are financial donations that organizations or individuals want to give. So we've been doing a lot of matchmaking between here's what the needs are we're hearing, and here's what the resources are that are available to meet those needs in the community. Flexibility has definitely been the buzzword. We have been needing to meet changing needs through flexibility. So older persons have been choosing or have been told through shelter-in-place orders that they need to be staying at home. And so we've needed to address social isolation, and we've needed to address the need for deliveries of food and medicines and supplies, and shifting activities and educational sessions from an in-person model to virtual model. We've had to deal with the fact that senior centers are closed, and so congregate meals are shifting to home delivered meals, and activities are increasingly virtual. I want to say a word about that shift from congregate meals to home delivered meals. Just when we look at the first month, the month of April, compared to what we typically had in an average month last year, our April home delivered meals in this region were about 86,000 meals to almost 4,000 clients. we're looking at an increase in April of 85% in the number of individuals who are receiving home delivered meals. And we're expecting that as funds become available to increase those home delivered meals, that those numbers of clients receiving meals will only increase. Transportation changes, we've looked at the need and the ability to provide client trips shifting and more deliveries being used by the transportation providers that we fund. And then we're looking at the fact that clients have been declining in-home support. So, for example, they've been reluctant to have people come into their home. So there has been a need for more telephonic check-ins. There's been a need for more protective equipment for clients and workers. And we've been seeing an increased request for assistive technology to help people have the independence they need at home. So we and our network of providers have had to be flexible to change how we provide services and sometimes even what those services are. I want to say a little bit about some risks that we are facing as well for older persons in our region. We're looking at the exhaustion of some caregivers and care partners. We're looking at residents of long-term care facilities who have less interaction and less oversight and support. And we're looking at reports that are telling us nationwide and even globally that elder maltreatment is likely on the rise. That's especially concerning as social isolation is a key risk factor for elder maltreatment. Having said all of those things, though, we are very grateful to the federal and state funding streams and to the flexibilities that we've been provided that have helped us adjust to the changing needs of our region. And I want to talk a little bit about those opportunities that are coming our way in our region. First, I want to talk about the CARES Act. You may have heard about this. Congress passed the CARES Act this spring, and it has lots of different parts to it. But one of those parts is that it is providing the largest funding stream that we're receiving for aging services in response to COVID-19. Our region will be receiving a little bit over $6 million from this fund to provide services to older adults. And our plan is to use that funding, which will be available from now until September of 2021, in these categories. In caregiving, we're looking at consumer-directed service. If you're not familiar with that term, what that does is allow clients to have flexible budgets to allow them to determine what their care needs and care goals are and to be able to work within that budget. We're also looking at purchasing vouchers for respite to give care partners a break, whether that's a break to have someone come into their home and provide care, or possibly going to an adult day center and being able to have the older adult receive care there where the care partner is able to get a break. We're also funding kinship case management, where grandparents are raising grandchildren. We will be funding an expansion of our behavioral health coaching program, where we serve clients in affordable housing settings to reduce their risk of eviction due to behavioral health needs. We've been providing emergency material aid for urgent short-term needs, and we're on the brink of launching a new telephone reassurance program, and we're looking forward to expanding the opportunities for volunteers to work with us in that reassurance program. And then lastly, we'll be further expanding home delivered meals with the CARES Act funding. The CARES Act is not the only help that we've received for older persons in our region. We've received some philanthropy donations from the Greater Atlanta COVID-19 Response and Recovery Fund This is a fund that's organized by the United Way and Community Foundation, and they early on provided us with funding for meals for the older persons who are on our waiting list with the highest priority needs. And we also received philanthropic donations from the Thanks Mom and Dad Fund for urgent short-term client needs, and we're very grateful for those donations. In addition, we've received some funding for meals for older persons through the Families First Act. Again, that was another congressional action. And because of state flexibility, we've been able to shift funds that typically would support our Senior Hunger Coalition. And that's been going to provide food from a local farmer's market, as well as to support a food pantry at a nonprofit. So we have very much appreciated these new funding streams and flexibilities in response to COVID-19. To date, we've received grants totaling nearly $8.5 million, and that's about a 30% increase if you look at our annual aging services budget. So it's a big shift for us, but one that we welcome. I will add a note of uncertainty and a concern, and that's because, as many of you know, right now the General Assembly is looking at what's happening with the FY21 state budget. So there are some concerns that we might end up losing some state funding as well for home and community-based services in FY21. But I do want to say that uncertainty is out there, but we are very grateful to the donors and to Congress for including home and community-based services to older adults in these funding streams. And I also want to give a word of appreciation to our county and nonprofit partners who have demonstrated amazing creativity and flexibility, and they've worked so hard to adjust services to meet these changing needs. Last, I wanted to end with a little bit of good news. This gentleman here is a client who used to attend congregate meals and activities at CPACS, a partner with us. CPACS is the Center for Pan-Asian and Community Services. And this gentleman is now getting culturally appropriate nutrition delivered to his door rather than in a congregate setting. But I wanted to close with this quote from an article that is in this month's Journal of Aging and Social Policy. Social distancing requirements due to COVID-19 have resulted in a rapid and dramatic shift in service delivery modes. Area agencies on aging were able to quickly pivot to their longstanding expertise and community needs assessment and partnerships. And of course, none of this work is done without those strong partnerships. So next, I will turn it over to our next speaker so that you'll hear from one of our amazing partners and grantees at Cobb Senior Services. Thanks so much.
Thank you so much, Becky. A quick reminder to our audience, feel free to submit questions by clicking the questions box. We will be addressing as many as we can get to at the end of the webinar. Our second speaker today is Dr. Jatunn Gibson. Dr. Gibson is the Director of Senior Services of Cobb County. She has more than 25 years of experience in healthcare, working in various roles to implement and evaluate programs, both in academia and in public health settings. These programs focused on the health of the aging population and their caregivers. Currently, Dr. Gibson provides leadership for the Senior Services of Cobb County, which is focused on addressing concerns and improving the lives of Cobb's 55+ population. Ensuring a community approach, Cobb County seeks partnerships with all organizations in the aging community. Dr. Gibson maintains her certification as a Master Certified Health Education Specialist and a Certified Aging in Place Specialist. She has one son who lives in Houston. She also continues to learn from her mother, a retired educator who lives in Valley, Alabama. Dr. Gibson, thank you so much for being here.
Thank you. Let's see if I can get my slides up here. Can you all see my screen, the slides yet?
Not yet. I think you still have to accept to be the producer or the show, accept the screen share. Yeah.
Here we go.
Not
Almost.
Yep, we're good. Thank you.
All right. Very good. Thank you, Kate, for that introduction. I really appreciate it. And, I was listening to Becky, and a couple of the words that she shared with us. As a partner, you have to be flexible. And one of the bigger things that we had was the patience. You have to be very patient during this time. And we really want to say thank you, first of all, for inviting me to be part of this panel, and then also for the great partnership that we have with the Atlanta Regional Commission. So two things that I will discuss during my time. I'll talk about the implementation of services, as Becky shared. There's a lot of things that we had to change in the service delivery, and I'm going to focus really on our Meals on Wheels, which is where most of our funding came from, and that's the second part of what I will talk about. So I will address implementation of services and the augmenting some of those services, and then the funding sources that Becky also mentioned. So if you look at the current slide, the very last one on there, it talks about the Meals on Wheels, correct? So let's look at our Meals on Wheels and what's happened during this time. Well, it's not advancing here. Let's try. So it doesn't want to advance, but we'll try again here.
Try clicking into the PowerPoint. Sometimes that messes up.
Okay, there we go. So our Meals on Wheels is what I mentioned earlier. If you look in the brown box, we changed our delivery dates. That was the biggest thing we had to do, because prior to COVID-19, we delivered meals Monday, Tuesday, Wednesday, Thursday, Friday. It was a 5-day delivery. So two things were affected by COVID-19. The first thing is we were trying to figure out how can we reduce the amount of contact that we were having with our clients, and also reduce the amount of staff and volunteers that we were actually sending out to deliver those meals. Well, the bigger piece of that we didn't take into consideration initially was, well, COVID-19, the initial caution that was given out were for older adults. Well, who do you have most in your volunteer group? Older adults. We, out of an abundance of caution, and many of you have heard that phrase, we asked our volunteers to not work with us for a while, because again, with them being in the older population, them coming out, there was also a concern from many of them. Wait a minute, should we be doing this? So we agreed, yeah, let's shift. So moving from all of our volunteers that we use to do our Monday through Friday delivery, we shifted to our staff. And then we also reduced the number of days. We didn't reduce the amount of food that we delivered. So we modified the days that we delivered. And then we had to modify the staff, because many of the staff, we would help when needed, but we didn't really know the routes. We didn't know how, some people you had to actually take the food in the houses. Some of those things we didn't realize. And as we continue with this, we've learned a lot. And one thing we really learned from this, and we always did, but you appreciate things more when you don't have them. Our volunteers are a big, big part of our Meals on Wheels, and we really appreciate them. So if any of them are listening, or if you have volunteers, think about how important they really, really are to your services and your delivery. So that was two things we did with Meals on Wheels. The other thing you want to think about is, how are you, because Becky also mentioned in her presentation the increase, right? So Cobb Senior Services has seen a 22% increase in the number of seniors served since the onset of COVID-19 pandemic. Why? So there are many concerns from seniors about leaving their homes to go out and get food. Some of them use public transportation, which is now a concern. They also had maybe family members that were able to come and help and assist them, but now maybe not so much, because again, with the social distancing, there was a concern of being around a group of people, going to the stores, walking in those stores. So we've seen a big increase. The other increase that that has affected us is we closed the senior centers, as most of you have heard, or most of you have done. Close your senior centers. When closing the senior centers, the congregate, or the people that congregate together, or in-person eating, the people that came to the centers and were able to sit and eat together, they're now at home. So how do we make sure we still continue to provide them with a hot meal or a packaged meal or other things that they need. And I'll share that too as well. There were some concerns and some questions about how are we going to get other things we need. So that was a 22% increase. And as Becky mentioned earlier, I'm quite sure that will increase. So this number was from our mid-March to mid-April range, end of April. And that's when we really started seeing the pandemic and the effects that it would have on our clients. So when you think about that, you think about what is the biggest barrier that you will have to meet this increase. Well, I can answer that. Since you asked me that, I'll answer it. It's funding. How do you fund an increase? As you know, if you have budgets, you try to match dollar to dollar and that kind of thing. But if you get an increase in this amount, how does it work? So that's when you think about how important it is to have partners. And that is the Atlanta Regional Commission. I'll say again, thank you to you all. And the funding and the partnerships that you all have actually sought to help us. So the funding that comes from the federal, she mentioned some federal dollars, the dollars come to the state, they come down to the region, then they come to the counties. So one of the funding sources that I will talk about is the Greater Community Foundation, the Community Foundation for Greater Atlanta. So how did that work? The Community Foundation for Greater Atlanta, which was in partnership with United Way of Greater Atlanta, granted funds to the Atlanta Regional Commission. The Atlanta Regional Commission then allocated those funds to various counties. I'm being one of those counties in Cobb County, and we were allocated roughly $4,400. We had a time frame to use that, roughly 23 days. And as I mentioned, such an increase, such a demand for services, it wasn't very hard to find the clients that we needed because we pretty much all of us have wait lists. So we use that funding, and it doesn't sound like a lot of funding, but if you're one of those 27 clients that were on our tier 1 list and you are now being serviced, and it's a temporary service, but we're continuing to work with ARC to seek additional funding to move them to more permanent. So again, that funding came from the Community Foundation of Greater Atlanta through the United Way to the Atlanta Regional Commission out to the county. So again, we say thank you for that. It's all based on the partnerships. And then the second one that I will discuss, the funding source, was the Families First, which Becky also mentioned. And that's the Atlanta Regional Commission funding to the counties through the Families First Coronavirus Response Act. Now, this is a large amount of money. Again, as she mentioned, this will take us through September 2021. This is how we can address the 22% increase that we currently see. Now, the projections for a greater increase, as we're seeing numbers with the coronavirus are increasing, we're not sure where it's going. We still have seniors that are seeking services. We've actually increased by, again, the delivered meals, as Becky mentioned, has turned into the congregate meals have now turned into home delivered meals. So you're still delivering meals to people that were currently on your home delivered meals list, as we know, Meals on Wheels. Now we've added the congregate people that were coming to the centers and actually sitting down with each other and eating. They're no longer doing that, so we've added that group. And then there's that other group. Those are the ones that are now seeing, oh, wow, how long can we function? We're not going to the stores. We're not getting the food delivered to us. Where do we turn to next? So these are some other things that we're doing in trying to meet the needs. So this funding fills that gap, that 22% gap that was initiated by the request and demand. We're using funding for that. And as Becky mentioned, there will be other funding coming, and I'm quite sure there are other needs in the community and from seniors. So those gaps are being filled with this funding. So we increased our frozen meals, our pantry boxes, fresh produce to the seniors, and we've seen a great increase in requests for toiletries. You know, initially we couldn't find them, you know, when this all started. Everybody's looking for tissue and paper towels. But if you think about the seniors who were using some of our services for transportation to the stores, now how do they get toothpaste? How do they get toothbrushes? How do they get other items that they need, personal items, soaps, those kinds of things? So we're seeing a lot of requests for those things. So again, this funding was great, and it was you know, they move very quickly. Atlanta Regional Commission has moved very quickly to make sure that we receive this funding and it moves out in a fast manner, as she said, to the community. That's the important part, is that we can move this funding from our hands to the community. So those are the great things we've done there. And what we want to show you are 2 other resources. If you're watching and you know people in Cobb County that are in need of assistance, please direct them with this phone number to call us. And if they leave a message, we'll call them back. This is how we try to figure out and reach into the community. If they have internet access, please go to cobbseniors.org. There's a lot of information on there. Reach out to people that you know that may not be aware of what's happening with us. And in Cobb County, we're trying to reach as many as possible and assist as many as possible. So again, I thank you, Atlanta Regional Commission, for hosting this webinar and inviting me to be part of the panel. Thank you. And our hashtag that we've added to all our things is change the way you age. And who can help you better than Cobb Senior Services? Thank you.
Thank you, Dr. Gibson. Our third speaker this afternoon is Cara Pellino. Ms. Palino is the Unit Manager for Access to Services in ARC's Aging and Independent Services Group. She has a background in developmental disabilities and has been working in aging services since 2006. She was instrumental in the development and implementation of Georgia's first non-Medicaid self-directed program known as Support Options. In her current role, she oversees consumer information services, community options counseling, the EmpowerLine Pro resources team, and the Medicaid waiver and community transitions units. She has a bachelor's degree in English literature from St. Bonaventure University in New York, as well as a bachelor's in psychology from Kennesaw State University. Thanks for joining us, Cara.
Thank you, Kate. All right. All right. Sorry, guys. Here we go. Okay. All right. So Becky touched a bit on EmpowerLine more broadly in her presentation. I'm going to speak a bit further, go a little deeper into what we're doing with EmpowerLine's ADRC. So EmpowerLine is the Atlanta region's ADRC. The ADRC is an Aging and Disability Resource Connection. They are all over the nation. They are a free one-stop shop for information about services and programs for older adults, people with disabilities, caregivers, and professionals. I always say, if anyone is even thinking about calling us and you don't know if you're in the right place, just please call and we'll help you get where you need to go. The ADRC is an integrated point of entry to services and supports and provides trusted and unbiased information on a full range of service and support options. If we don't provide the service ourselves, we're going to connect you to the people who do. And this work is done in an extremely person-centered way. It's not a one-size-fits-all approach when people call. We're not putting people in boxes of services. We're really trying to get to the heart of the matter, the reason they're calling, and help them get the services they need. We're helping people make informed choices about the services that best meet their individual needs and their preferences. So the core ADRC services, and as Becky said, during normal times, but this is still what we're doing, we provide information counseling, intake and screening, options counseling, and telephonic caregiver support. At the heart, though, of all of the ADRC services we provide is information and counseling services by certified information and referral specialists who are skilled in assessing the needs of the caller and are also knowledgeable about resources. We not only provide linkage to supports and services, but we're also able to explain the process, how to access services, and what to expect. So we're not just handing out phone numbers and names of programs. We're really helping people understand what their options are, what the benefits are, so they can make the best decision. The goal is to provide relevant and timely information to help people make informed choices. The counselors are trained in motivational interviewing techniques, and they're often able to help callers identify additional needs or get to the heart of the problem. We answer about 70,000 requests for information a year. That's about 6,000 per month. And we could not do the job we do without, Becky mentioned it before, ePro or EmpowerLine Pro. That is our extensive resource database. It's a disability and long-term care specific database with more than 26,000 resources. This database allows information counselors to customize information and resources based on the individual's preferences and needs. It allows for highly customizable searches. You know, if someone is looking for a personal care home that allows smoking and also pets, we can help get them where they need to go. And the system contains everything. It's not just services, but also things that the callers might like to do. Everything from exercise classes to potential placement in nursing homes. And the database, all providers in the database are thoroughly vetted, and they're required to meet very stringent inclusion criteria, including things like state licensing and liability and a lot of other things. And to let you know, ePro or EmpowerLine Pro is available to professionals by subscription. So I just wanted to let everyone know that as well. And also, as Becky and Jatunn mentioned, all of this work really, it's not done in isolation. We have an extensive partner network, and we count on our partners to provide the full suite of home and community services and to share resources. And I'll talk a little bit more about that as we move on. So why would someone call the ADRC? Many times people call us when they're in crisis, and this may change based on current events such as COVID or extreme weather, extreme heat during the summer, extreme cold during the winter, government shutdown. People's needs are changing. But most of the time people are calling us if they have an immediate need. They might be living in their car and looking for housing. They may have just recently had their utilities cut off. Maybe they've been recently hospitalized or have a new diagnosis. We also get a lot of calls from caregivers seeking help. A lot of people feeling overwhelmed. Maybe they're unsure how to care for their loved one. Oftentimes, they need to work full time. They can't afford to have someone come in and care for their loved one, and they're trying to juggle both. And sometimes people are just calling to get information on caregiver support groups or even education. Then we get people calling about very specific resources that they know, maybe at the local senior center. And then we do get calls from people who they know they need something. They're not quite sure what's available or even what is needed. So with COVID, we're seeing a lot of calls from atypical callers, young, non-disabled people calling in, calls from employers asking how to get their essential worker letters, calls from employees asking about unemployment benefits. We're also getting calls from people who typically receive help in their home, but are now left without that help as people are sheltering in place, or the people that we serve are refusing services. Sorry, guys. We're also seeing calls from people, the calls are getting more complex. So we're seeing calls from people who maybe are still providing caregiver services to their loved ones with dementia or even behavioral health needs. And because of COVID, daily routines have changed for all of us. And so people are calling in and they're experiencing odd, unusual, or maybe increased behaviors of the people that they're caring for, and they're looking for resources to help with that. We've had many people call as a result of COVID, needing food delivered to their homes, needing help paying for utilities and rent, and also help accessing assistive technology. So what have we done in response to this? To adapt to these changes we're experiencing as a result of COVID, we are really just using the tools we always use, but we're expanding the reach of those tools. So we're still relying on the skill and expertise of our information counselors and the ePro resource database, and we're collaborating with our many partners, both formal and informal. We are communicating almost daily with partners and then again internally to share resources. And we have a lot of partners, and Jatunn is one of those, and she mentioned a few others, as did Becky. United Way, Atlanta Legal Aid, Hope Atlanta, a lot of people. I'm almost afraid to mention any. But we're all sharing new resources as additional funding related to COVID is coming in, which populations can be served, what the time frame is for using that funding, and then how to help people access those services. We've also internally created a frequently asked questions list. We are getting so many calls that are not typical for us, and we want to still be able to help people get to where they need to go or provide the information that they're asking for. So we have created a frequently asked questions list that addresses things like Department of Labor new rules through the Families First Act, how people can access unemployment benefits, what's happening with stimulus checks, etc. We have also, using EmpowerLine Pro, created a new COVID-19 specific record. So as I said, there are more than 26,000 resources in the database. We have created a record specific to COVID-19 because things are changing so quickly. As you saw from the previous two speakers, money is coming in and it's going out very quickly. And there are rules attached and there are timeframes attached. And so the specific record in ePro is allowing all of the counselors that use it, and it's used statewide. It's allowing all of the counselors to give people the most relevant, up-to-date information as things change. And then, of course, internally, we're having really daily conversations and emails letting people know what those new resources and any changes in process are. We have been helping people access assistive technology. One of the funding streams that Becky had mentioned, the Thanks Mom and Dad Fund, it's being used to help people who have urgent, immediate needs. And so we have seen a real big increase in assistive technology. People who are, without caregivers, they want to take a shower safely. We're able to provide them with some assistive technology. Maybe their caregiver is the one that helps them manage their diabetes, and they have a vision impairment. So we have talking glucometers. A lot of things where we can use technology to help alleviate the burden of reduced caregiver hours or no caregiver hours, and to increase or maintain the independence of the people that we serve. And then we're also using that funding, we're helping people get groceries delivered to their home, and also some payment with utilities. So really trying to meet those immediate needs of people that would not typically be calling us. So I've spent a bit of time going over our core services and our approach to delivering those services, because I want everyone on this webinar to know that regardless of changing environments or needs, including the COVID pandemic, that ADRC, EmpowerLine's ADRC, is available to help people navigate new and existing resources and services. So don't hesitate ever to give us a call. And what I should have done is listed our phone number, but our EmpowerLine number is 404-463-3333, or you can visit us at empowerline.org. Thanks so much, everyone, and I'll turn it over to Kate.
Thank you so much, Cara. We have a few minutes left before it is time to wrap up, so let's go ahead and address a couple of the questions that came in from our audience members. Here's a question for Dr. Gibson. Someone asked, what are some non-food items that Cobb received requests for? And if you did receive those requests, how were you able to secure those items?
Sure. One of the bigger requests we had, of course, I mentioned during that time, I'll mention two and how we were able to secure those. So the first one would be toiletries. And the second big request we had was for pet food. Many of the seniors called, and those were the two things that they didn't get when we delivered the meals. We had to really become creative in collecting donations. And so we used our strategic partnership manager to work with other partners that we had to, and we sent out specifics. What are we looking for? We sent out specifics on the toiletries. We sent out specifics on the pet food. We sent out specifics on other personal items, soap and toothpaste, those things that I mentioned. So it was a very strategic manner in which we were able to collect those items. And we just kept that going through our partners and informing them on what our specific needs were. Not just saying donate to help seniors, but we specifically sent out lists of items that we needed.
And a question here that I think Cara or Becky might be able to address. Someone writes, I've heard about some online search sites for senior services like Aunt Bertha or call centers like A Place for Mom. What is the difference between EmpowerLine and those options?
Cara, you want to take that one, and I'll add to it if there's anything else I think of?
Sure. One of the things we're most proud of as the Aging and Disability Resource Connection is that the information we provide is free and it's unbiased. And some of the places that are mentioned that you see ads for on TV, they actually, the resources that they're able to provide, they comb from other providers, so they're not updating, or the information that may not be as accurate or relevant. Additionally, some of these people that also offer placement, they get paid based on where the people are based in the community. So if someone opts to move their loved one into a specific personal care home, then they might get paid to do that. So the ADRC, the intent of the ADRC is to provide the most unbiased, comprehensive, accurate information so that people can really understand what services and options are available to them so that they can make the very best decision for them or their loved ones. Becky, did you want to add?
I did want to add one more comment. I think that was a really important point you made about the more comprehensive and unbiased approach. But the other piece that I think I would add too is that we have trained counselors. Yes. And so you can go online and search for providers out there, but you won't have that kind of one-on-one, let's talk through all the possibilities that might work for you. And oh, by the way, did you even think about this possibility? Or did you even know what this vocabulary means? I mean, we all have this speak, right? We all think people know what respite means or what congregate meal means, but if you're not in this world, you may not know what those terms mean. So helping people really understand the services that are there and what might be appropriate for them is a piece that we're able to add with our trained counselors as well.
And we have someone who asks two questions. One, they say, I'd like to volunteer specifically for reassurance phone volunteer. How do I do that? And second, how do I qualify for food deliveries?
Well, the answer to both of those is call EmpowerLine. So the number was put in the chat box, I see, 404-463-3333. Or you can go to empowerline.org and get the information there. In fact, at the top, it specifically says if you're interested in volunteering opportunities, there's information on that. The telephone reassurance program hasn't launched yet. We're actually in the process of building it right now, but stay tuned. We will be launching it very, very soon, and we're really excited to have additional volunteers. So whoever wrote that in, thank you for your interest. And if others are interested, let us know that too. We'd go ahead and take your name now, even if we haven't volunteered.
Love to have you. And we have time for one final question. This is directed towards Dr. Gibson. Has the increase in requests for services given you an opportunity to reach seniors who are not familiar with Cobb Senior Services?
Yes, it has. That actually is a very good question, because with that 22% increase, some of it has been because of people sharing the great work that has happened from the Atlanta Regional Commission through Cobb Senior Services into the community. One thing that we've done We started a drive-through. Seniors on a Thursday, we have seniors that drive through, and that word just spread like wildfire because there's still a need outside of the seniors that we were recently connected with. So we've connected with another group of seniors. So during this time, as we were moving resources out that we received from the Atlanta Region Commission and other organizations, as we were moving those resources out, we were able to market to other people. And, you know, again, as word of mouth is very good, it has moved to also assist us in reaching other areas in Cobb County that we quite, you know, we had gotten into those areas, and sometimes you get the people, oh, we don't have the need. And then you say sometimes it's forced because of there's an emergency, but it has been great for us to reach into the community because we're doing more, we're expanding more, and we have to come with those innovative ways to reach people. So it has been a great connecting tool for us.
Okay. I believe that wraps up our Q&A portion. If we could please move to our closing slide. I just want to say thanks to all our speakers today. Actually, first off, thank you so much for joining us, everyone. And thanks to you, audience members, as well. Now, you may have noticed over the past few weeks that ARC has been presenting webinars about once a week on various topics. Please visit our webinar library page. That's at atlantaregional.org/webinars. for information on upcoming webinars. That's atlantaregional.org/webinars. Thanks again so much for joining us today. Our session today is concluded.